In the second wave of coronavirus, India was devastated as never before. Hospitals are flooded by daily increasing cases of COVID-19. Sudden rise in the demand of life-saving oxygen makes the situation even worse, resulting in more deaths. Horrific picture of mass cremation, cries of love and the dear ones are the routine telecasts in most TV channels for weeks. Dead bodies of the poor people buried on the banks of Ganga, while many more dead bodies were thrown out into the holy river of India. Most state governments were forced to impose lockdown to contain the unpredictable virus. Streets deserted, school colleges closed, commercial establishments, governmental offices shut down, paralyzing everything. Looming fear of economic downturns, the authorities could do little at such an exponential spike in the number of cases all over India, reaching as much as 4,14,188 cases on May 7, 2021 and 4,529 COVID deaths on May 19, 2021 in a single day. Now let us know how it happens.
So the number one symptom is headache, and then followed by sore throat, runny nose and fever.
The government's own study says that the Delta variant is dominant here in India. The Delta variant is responsible largely for the second wave of coronavirus in India. The Delta variant is 50% more transmissible than the Alpha variant, which was first found in the UK. The Delta variant can cause breakthrough infections. Now, what does that mean and why is this worrying? Breakthrough infections means essentially a reinfection of COVID irrespective of antibodies. So it means that this variant has the potential to evade or break through the antibodies in your body. A breakthrough infection is when you get infected after getting the COVID.
A new study out by the United Kingdom's Public Health has said that 2 doses of vaccines do prevent hospitalization from the Delta variant. It was the Delta variant which was mainly responsible for that extremely cruel second wave India just faced. However, this is only when you have 2 doses. 2 doses are highly effective against this hospitalization. It doesn't work with just 1 dose. The Pfizer-BioNTech vaccine was 96% effective after 2 doses. The Oxford-AstraZeneca vaccine, which is Covishield, is 92% effective after 2 doses. They had studied over 14,000 cases completely, of which 166 were hospitalized between April and June. But the big message going out is that you have to actually have both the doses.
Subscribe now and press the bell icon.
What about the Delta variant? The one that used to be called the Indian variant, because that's where it was first detected. The data shows that actually it's much more transmissible than many experts, including myself, thought at the time. The latest estimates suggesting that it has an R0 of around 6, which is about twice as transmissible as the original variant, which means that one person will on average infect 6 others in normal non-lockdown conditions, which is really very infectious. This is a very sticky virus, and it's explaining in a way why it's done so much damage in a short time, despite the lack of individuals to actually attack. And if you are double vaccinated, there's some reduction, we think, in protection, but it's only very minor. And so your risk is still at least 5 to 10-fold less if you've been double vaccinated. And we know from our data from the Zoe app that if you get it, you're going to get a much milder, shorter duration version, make it highly unlikely you're going to go to hospital. So that is a really good reason to get that double shot.